This is the MediNail Podo Palmar patch program by Dr. Robert Spaulding and Dr. David Velarde. Disclaimer: LifeWave and MediNail does not treat specific diseases, nor do we create patch protocols designed to treat any specific condition. You cannot diagnose unless you are a medical professional. As per LifeWay's disclaimer below, please always consult with your physician or other qualified healthcare providers before embarking on a new treatment, and do not disregard any medical advice. Please consult your own physician or appropriate health provider about the application of any opinions, recommendations with respect to your own symptoms or medical conditions, as those diseases commonly present with variable signs and symptoms. MediNails assumes no liabilities or responsibility for any damage or injury to persons or property arising from any use of the product, information, idea, or instruction contained in the materials provided to you. LifeWave and MediNail reserves the right to change or discontinue at any time any aspect or feature containing our information. Attention, this is important. Everything we demonstrate today is important. You tell your client to coordinate any patch application with their treating doctor to be sure the underlying cause is identified, treated, and monitored by a health professional. The MediNail Podo Palmar Patch Program, or MPPP. The MediNail Podo Palmar Patch Program is also brought to you by Dr. Velarde, who's founder of the Stargate Clinics, which is a new type of non-medicated pain clinic. The patches used by MediNail in this presentation are made by LifeWave, the IceWave, and the X39. What is IceWave made by LifeWave? LifeWave's IceWave patch product combines ancient acupuncture with a remarkable breakthrough technology patch. Your body produces heat and light, which stimulates the patch compounds to vibrate at a microfrequency that activates various molecules that are already in your body. The patch has simple amino acid crystals, salt crystals, and ionized water. One of these molecules found in your body is copper tripeptides. Copper tripeptide activation produces endorphin responses that temporarily control pain. IceWave also interrupts traveling pain signals to the brain. Reportedly, LifeWave X39 stimulates stem cells for cellular repair. What is acupuncture? Acupuncture uses the body's meridians. Meridians are superficial dermal nerve pathways called dermatomes, as demonstrated here by the meridians on the foot. The difference of reflexology versus acupuncture is reflexology has specific points on the foot's plantar surface and on the top that will activate other organ systems in the body, as opposed to acupuncture that uses meridians. So why did Dr. Spaulding bring LifeWave to MediNails? After being in practice for 26 years, I have never seen an OTC, non-medicated, non-transdermal product like IceWave that has so many positive benefits with no major risk factors that anyone with some basic knowledge can apply. Because IceWave has impressed me so much and demonstrates such positive pain responses on so many levels without risk, I cannot, as a physician, duplicate the effect. The fact that LifeWave's IceWave has been on the market for 21 years shocks me that I have never heard about the immense value of the LifeWave products. I had to share this with everyone in the MediNail program and develop specific training for the foot. I share this remarkable product with everyone I meet to let them experience the IceWave wow factor. This MediNail specific lecture briefly covers IceWave product education as it relates to extremities in your scope of practice in the hands and feet. Ice wave is a temporary means to control discomfort and is not a cure for underlying causes. What is a very common topic that goes on daily at your salon service table with clients? Well, you talk about medical conditions like arthritis and old injuries that cause pain, whether it's in the back, the neck, the hip, knee, or where you service the hands and feet. When someone comes to me or another doctor with pain, many times I give trigger point injections or prescriptions. How would you like to offer some real potential relief to your clients with foot and hand pain without injections or prescription medical products in the main areas of your scope of practice, in other words, the hands and feet? For those who have taken the MediNail, Advanced Nail Technicians, Medical Nail Technicians, the CCPMA, or the Foot Care Nurse programs, you will recall the following foot problems. Here are some areas of foot pain you may see, like bunions, like arthritis, like plantar fasciitis. And if you look at the rest of them, you may also be familiar with some of the other terms. The top 10 foot conditions, and there are a lot more, are heel pain, neuropathy, metatarsalgia, arthritis of any foot joint, tendonitis, capsulitis, sprains of the ligaments such as the anterior tibiofibular ligament, biomechanical deformities like bunions and hammer toes, Morton's neuroma, stress fracture pain, and trauma with bruising or lesions like IPKs, porokeratosis, and warts, but not suspicious lesions. Our focus today will be on 5 foot and hand conditions, and we're going to start with the feet: heel pain, neuropathy, metatarsalgia, sprains, and arthritic joints and bunions. Number 1, heel pain or plantar fasciitis, also called heel spur syndrome, is where 50% of the U.S. population may have heel spurs visible on x-ray, but not 50% of those people have heel pain. Number 2, neuropathy pain, sensation of burning, pin, prick, or tingling, not just lack of sensation. Number 3, metatarsalgia, which is pain in the metatarsal heads. Number 4 is going to include arthritic joints, bunions, calluses, and fissures. The last one, number 5, are chronic sprains. These are not acute, but with previous x-ray to rule out fractures. There's about 25,000 sprains every day in the U.S. 30% of those ankle sprains will still have pain 1 year later. So how do we start with patching? Well, first we gently find the trigger point pain, which could be in any of these areas. Next, we want to open your IceWave product sleeves and get out a tan and a white patch. Instructions: you will find the tan or brown and white patches. You place one tan or brown patch on or near the point of pain and one white patch on the dermatome or meridian of the body using any 2 locations at a time. You apply the patches to clean, dry, undamaged skin. Another way to think of this, consider the tan as the negative point that goes on the pain point, and the white, which is positive, and circles near the tan patch or the opposite side of the body. So remember, the tan or brown patch goes on the trigger point where you can depress and feel, and the patient will tell you or client will tell you that that is the point of pain. And the white patch goes in a circle an inch or 2 away from that area as one method as to find the point of pain relief. So again, number 1, find the trigger point pain and apply the tan patch directly on that spot. Number 2, rotate the white patch in an expanding manner in a circle around until you find the best point of the contact that gives relief. and you can expand or the width of the circle with the white patch, again, for the best spot for pain relief. So here is an example with met pain or metatarsalgia, pain from a callus underneath the third metatarsal. And you mark that spot, and you also find the trigger point that makes that the most painful, and you apply the tan patch. Again, with the met pain from a callus or other area that you might have pain as a result in the head of the metatarsal, you put the brown patch. And again, you move the white patch in a manner, usually in a circle, and you can expand this circle and go to other areas of the foot to give you the best secondary relief of pain. Here is another example with heel pain. First, you locate the point of the most heel pain with your depressing your finger or thumb. Then you apply the tan patch, and then you rotate the white patch until you find the best relief of pain. Here's an example of the third metacarpal, right at the head of that metacarpal. You find the trigger point pain and put the tan patch, and with the white patch you move it in a circle until you find the best relief of pain. Here's another example of metatarsalgia, but it's on the top of the foot. When you press down on the top of the head of the metatarsal, that's where you would put your brown patch. And then the second patch, or the white patch, would go in a circle until you get some pain relief. And then you apply it. Here is another example of patching the third submet, or the metatarsal, under the third toe. Right where the digit connects to the head of the metatarsal, you put the brown patch. And instead of moving it in a circle, you take the white patch and put it in the exact opposite position. One goes on the bottom where the pain is, and the white one goes on directly on the top of that third metatarsal. Sometimes that's the best way to get pain relief. Here are 3 different options on how to treat neuropathy. The first one, where you're getting all the toes that are involved in tingling or burning, you put the central patch where the central area of that burning and tingling, you put your brown patch. You move that white patch in a circle. Or you can put the other patch, one patch on the bottom and one patch on the top, and see if that gives relief. And then there is a third method for neuropathy. Put one brown patch on the forefoot where you're getting the most neuropathy, and the second white patch in the sinus tarsi, which is in this location right there where the ATF ligament typically is. Here is a male patient who came in with metatarsal pain from a callus on the bottom of his foot at the third submet area, and it was secondary to having multiple hammer toes. And we put the brown patch on the callus, and we put the white patch on top of the foot in the same area on the third metatarsal, and he got immediate relief of pain. Here's a lady that came in with an interdigital corn on her third toe on the medial aspect of the third digit. We put in a toe spacer, but for treating the pain, we put a brown patch right behind the digit and a white patch in the sinus tarsi and got immediate relief. Key points for patch placement. Most reasons that you don't get immediate patient relief is not taking the time to properly find a meridian that works. Sometimes you must place the white patch even on the other side of the extremity or opposite side of the body to see relief. Do not patch open wounds, ulcers, fractures, or draining areas or infections. You need to refer these on to the doctor immediately should they come in your office. Do not provide services to these individuals. Here are some more examples of whether you patch or refer or both. In most of these cases, especially the first one, that can actually be a melanoma if you don't have a history of bruising. These other ones have open wounds and or severe biomechanical problems that's going to need a podiatrist to address. The following information is very important to remember. Cautions with LifeWave products. Remove immediately if you feel discomfort or skin irritation occurs. Do not use or reuse patches once removed from the skin. If you have a contact allergy, that's something significant to adhesives that you need to be aware of. Do not use on wounds or damaged skin. It's for external use only. Do not ingest. Ask a health professional before using if you have a health condition. Any questions or concerns about your health. Do not use if nursing or pregnant, and not intended for use on children. Do not apply used patches other than directed. And the product needs to be stored at room temperature. LifeWave products may activate at 80 degrees and above. Do not leave in a hot car, direct sunshine, or your inner clothing pockets, or allow sources of heat to come in contact with patches or LifeWave sleeves containing the patches. IceWave patches, expansion of applications. Patches can be used almost on any area of the body. Patches can be worn up to 12 hours before discarding. Keep well hydrated while using this product. Only remove half of the patch backing until an effective placement site is located. You can also use tape to tape them in place until you find the right area. Once you find the trigger point pain, moving the white one around and using tape or just pressing it with your thumb until you find the area of best pain relief. Again, these patches can be applied almost anywhere on the body for pain relief. Knees, backs, shoulders, and these are some pictures that we're not going to get into because we're not going to be talking about other applications at this time. Here's some additional information and locations for getting knee pain relief. Here are some placements for headaches and hands and shoulders. Here is some additional information for neck and shoulder applications. Here are some results of using the IceWave and LifeWave patching products. Some people get immediate relief. Some people takes hours or days. It may lead to self-administered safe alternative options to control pain that the individuals come up with on their own. It may also lead to excellent financial supplements to a salon or spa services if you get good results with this. It may lead to helping clients with other body aches and pains that they had not addressed in the past or didn't want to take opiates or other drugs that could lead to additional problems. It also may lead to helping clients with other body aches and pains that would increase referrals for your services. It may lead to clients not having to depend on medication as often. It may lead to other helpful LifeWave patch products that may improve your overall health that we haven't talked about yet. And also, clients can become brand partners if they choose to do so and obtain their own LifeWave products at a better cost advantage. Or clients may introduce LifeWaves to their relatives or friends. You can expand into 10 other LifeWave products that can help overall health that we haven't talked about yet. The difference between the IceWave and the LifeWave X39. IceWave is more for temporary relief of pain. LifeWave X39 has other long-term positive benefits that you need just a complete education just on that product alone. So let's start patching. We've barely cracked the surface of all the products of LifeWave, but for information to sign up for just the IceWave, the MediNail Podo Palmar patch program, you can get with myself, Dr. Velarde, or Cheryl at the 423-756 foot number or my LifeWave number. Link is lifewave.com at Dr. Spalding. Dr. Velarde can be reached at lifewave.com at Stargate Clinic. And Cheryl Morgan can be reached at CherylMorgan59 at Gmail.